Hello, I'm Dr. Childress. Welcome to my series, Books from My Garage. I was so appalled by the ignorance and absence of professional standards of practice in forensic psychology that I just went out to my garage and got the books that are just sitting in my garage to show psychologists, to you people in forensic psychology, what you should be knowing. This is just in my garage. I just walked out there and grabbed this. So this isn't a prepared thing where I've looked at bibliographies. No, this is just I went to my garage and picked out the books. So here's a couple of books that I used to use to remediate my interns and trainees if they needed their help, support. And the first one is a child's therapy treatment planner. Okay, and these are just structured treatment plans for various disorders or for various symptom pictures. Here's one. Here's a chapter for oppositional defiant, and you see they give the behavioral definitions for oppositional defiant, then long-term goals. And you see short-term objectives, therapeutic interventions, and parents learn and implement good child behavioral management skills, and they can give a place for what those would be. Peer sibling conflict, post-traumatic stress disorder. They have treatment plans in here. So these are sort of boilerplate template treatment plans. If you know stuff, you can come up with better. But at the minimum, this is really easy to do. And the reason I have this is because treatment plans are considered standard of practice in clinical psychology. And when I come over to forensic psychology, I never, ever, ever see a treatment plan. I have not seen a single treatment plan in forensic psychology. Not one. And this is the book I have for interns. If an intern is not coming up to par on a treatment plan, then we actually go to the book and say, let's do it. So forensic psychology, this is for you. You need to start developing treatment plans because that's the standard of practice in clinical psychology. And so we're going to go back to real psychology. The days of kind of Wild West just making stuff up is kind of over. So we're going to be asking for treatment plans from you, the targeted parents, and that's total okay for them to get a treatment plan. Assessment leads to diagnosis, and then diagnosis leads to treatment. So we just want to know what your plan is based on what your diagnosis is. And then the other remediation book I have, just sit in my garage, is the Child Psychotherapy Progress Note Planner. And so if my intern had a problem with note writing or something, and so, oh my goodness, this just gives you it just gives you the sentences that you can use. So let me pick up a disorder. Oh, divorce reaction. Okay, here's a good one. So look at what they say about divorce reaction. Assignment of responsibilities by non-custodial parent. The non-custodial parent was given directive to assign chores to the child during their visits. The non-custodial parent was encouraged to schedule times for the client to complete their homework. Okay, so it actually gives the sentences that you will use in your chart notes. I mean, how much simpler is it than that? You pick your category, and then you get a sample of about 4 sentences that you can pick from to describe whatever it is you want. They have autism and oppositional defiant. That was divorce. So it's the reason this becomes important, forensic psychology people, reunification therapists and everything, is because moving forward, targeted parents, I'm going to be encouraging targeted parents to ask for your treatment plan. And if you don't have a treatment plan, we're not going to let you work with a family because you kind of have to know what you're doing, and we want to know that you know what you're doing. So come up with a treatment plan. There's ones you can just grab out of here. If you know more stuff, you can actually develop better treatment plans. But we're going to be asking for that. And the other thing, we're going to be asking for the treatment-focused assessment to document the symptoms. And if you become a big butthead, if you just become arrogant and say, "Oh, leave me alone," and don't tell me what to do, and that kind of stuff, which I've heard you've been doing. So if you get all arrogant and haughty about like providing parents with a treatment plan for their kid, well, then I'm going to recommend that the parent request your treatment notes. And one of the things we'll look at with that, I'll instruct parents as to what they're looking for. And we're going to look for, like, are you keeping good notes? Are your notes tied to your diagnosis? Do you even have a diagnosis? Do you have a treatment plan? And in some cases, I don't know, the parents may send me your notes and ask for me to write a report on that. Really? You want me to write a report on your notes? I wouldn't want Dr. Childress doing a report on my notes. But if you feel comfortable with it, that's up to you. But this is kind of baseline what I would expect from an intern. So if you're a mental health professional, you should be doing better, but at least this. So books from my garage on treatment plans. Get used to it. We're coming up with treatment plans. Treatment plans are returning with the return of clinical psychology. So follow me over to the next segment. I want to do a really interesting little book. So follow me over.